It's going to be a long TikTok, so I apologize early. Here's what the CDC did. They took hospitalizations of people with COVID-like symptoms and then tested them. And they had the two groups. You had the unvaccinated but had previously tested positive, and then you had the vaccinated group. If they came into the hospital with COVID-like symptoms, they got tested. If you tested positive. Now what they're saying is there's a 5.49-fold higher odds of an unvaccinated, previously positive COVID test person testing positive and getting a breakthrough infection. And I'm going to walk you through how they got to that 5.49 folds higher in odds. Let's start with the subgroups. 1,020 unvaccinated but tested positive previously, 1,020 hospitalized. Fully vaccinated, COVID-like symptoms hospitalized, 6,328. Of that, each group, 89 of the first group tested positive, and 324 of the second group of fully vaxxed people tested positive. And now how they got to the 5.49 increase in odds. So they're saying that only 5.1% of the fully vaxxed people that were hospitalized with COVID-like symptoms were tested positive, and 89 of the non-vaxxed people. That's how they got to their 5.49. But did you see the hospitalization rate? Follow me on this, because I have it by month. So in August, when I think 50% of the population had been fully vaccinated, there were 32 hospitalizations that recorded COVID-like symptoms, 3 of which tested positive, that were of the group that had previous COVID infection. Of the vaccinated, 2,049 hospitalized with COVID-like illness, and 32 tested positive. And this is in August, when I think 50% of the population were fully vaccinated. I'm not saying that their number is wrong. I just think they're misrepresenting the data a little bit. Just a little bit. Because for the unvaxxed, previously infected group, there's actually a decline in hospitalizations. But for the vaxxed group, it's an increase month over month. So their 5.49 odds increase for unvaxxed versus vaxxed. That's mathematically correct. But it's I'll be honest with you, the intellectual integrity here, that's shocking. And this by no means is me saying people shouldn't get vaccinated. I think that people, if they haven't been previously infected, they should. But somebody jumped through some intellectual hoops to get here. That's pretty alarming.